Ma'am, we are live now. With all your permission, I'm starting this session. Good evening, everyone present here. I welcome all the participants on today's webinar. And for today's webinar, the topic is cervical cancer screening. Before starting this session, let me introduce the moderator for today's session. And the moderator for today's session is none other than Dr. Bharti Karla, ma'am. And let me share some of the achievement of ma'am. Ma'am has done MD in gynecology and fellowship in clinical sexology, and she is consultant gynecologist at Bharti Hospital, Karnal, and she is editor general of medical nutrition and nutraceuticals from 2012 to 2015, editorial board member general of midlife health and Foxy membership, steering committee member DIPISI GDM registry 2018, Karnal Opsy and Gynae Society KOCGS, and President 2022 RSSDI Life member and AOGD Life member and POCOS Society Life member, and she is also Hypogynae Life member, and she is principal invigilator in the one global phase 3A clinical trial and co-invigilator in more than 50 global phase 1, 2, 3, 4 clinical trials, and attended as faculty at both national and international conferences, and she has more than 200 published papers, and first gynecologist in India with MCI recognized qualification in clinical sexology. By taking not much time, I would like to hand over this session to ma'am to introduce both the panelists of the session. Over to you, ma'am. Kindly proceed from here.
Good evening, dear friends. It's a very auspicious day for all the women all over the world. So that is why we are celebrating the World Women's Day. But is it for only the World Women's Day, for the international society? But for Indians, if we take it, I take the opportunity to pay gratitude to Madam Savitri Bai Phule. She had started first women education. We know women hold up half the sky, but at times they get, with this, the holding half of the sky, they get more share of diseases. Although they do very well in their life, multitasking, all kinds of works are done, much more than male counterpart. But God has given them special diseases also, which are related to their hormonal systems, just like autoimmune diseases or gender-specific cancers. So today we are going to discuss about the cervical cancer especially, and we have panel of expert doctors, Dr. Anita Kant ma'am and Dr. Anita Malik ma'am. So these will enlighten us the cervical cancer, whether it is preventable or not, what action we can take to increase our longevity and quality of life. So first of all, I welcome my speaker, Dr. Anita Malik ma'am. She is MBBS and MD in radiotherapy oncology, and she is at present working at Fortis Hospital, Noida. And she has offered various services in various, all the kind of difficult words, just to pronounce difficult words for even for layman, different kinds of tumors. And she has given services and very good results in their patients. And she is member of numerous prestigious associations like Delhi Medical Association, European Society for Medical Oncology, Association of Radio Operators of India, and Medical Oncologists of India. She takes interest in research and has published papers in reputed national and international journals. And she has been associated with postgraduate teaching program at AIMS, Delhi. So I welcome ma'am. And the other participant and enlightening person is Dr. Anita Kant ma'am. She is MD in Obs and Gynae and FICOG, and she is chairman OB-GYN services at Asian Institute of Medical Sciences, Faridabad. And she has special interest in obstetrics, endoscopy, and gynae plastic surgery. She is also a member of Foxy, IMS, various societies, and has multiple publications to her credit. Welcome, ma'am.
Thank you. Thank you so much for nice introduction.
Thank you.
Thank you so much.
Today we are starting with, first of all, the word cancer. Cancer means, to a layman, it looks like death sentence. Don't you think so? Madam Anita Malik, ma'am, what is your opinion?
Yeah, so cancer is not a death sentence because we have many patients who are coming in follow up.
I think, madam's that is signal is weak. Hello. Hello, am I audible? Hmm.
Yes, you are
Yes,
audible.
yes.
Acha, ma'am. So,
So, what I was telling, we have many patients who are coming in follow up. They are completely cured. The
okay.
patients who are coming in an early stage, the chances of cure is very good in those cases. So, so we are here. Our purpose is to spread the awareness so that we can detect these cases early.
Hmm. Dr.
So
Anita
the
Khan, ma'am. So, what
yeah,
do you mean by early? Dr. Anita Khan, ma'am, please
early means
enlighten us.
yes. So early means if it comes in a stage 1 or stage 2, the chances of cure is almost 80% or more than 80%.
Good.
But the irony is we are getting the patients in late stage. So the chances of cure are 20%.
Hmm. Dr.
So
Anita Kant, ma'am, as a
yeah,
gynecologist, how can we detect CA cervix early?
See,
okay.
what
So there
happens
are
is,
okay.
okay, continue,
Please go
continue,
ahead.
ma'am. Okay.
Yeah, please go
So
ahead. This is for you.
this is the commonest genital cancer, as we know, second commonest after breast amongst the women, and it is a leading cause of death from cancer in women. So now the problem is this, that we know that this problem happens, and it how it happens is that most commonly it is due to the infection by HPV virus, which leads to changes, and then the transformation zone, or the zone which is connecting the vaginal part of the cervix or the external part of cervix to the internal pipe of the cervix. So there is a change in the histopathology over there, and that transitional zone gets infected. So what we do is, to detect it early, we can just have a look at cervix whenever a lady comes to us for any other reason also, and we find if the cervix is not healthy looking, then maybe just apply some iodine and see if there is any color change. Or if we have the facility, like we are in urban areas, we can always go ahead and take a pap smear. Pap smear will pick up any changes in this transformation zone early on, and we can detect dysplasia much before actual cancer develops, or the early stages of cancer, which is called CIN. And accordingly, treatment can be given according to her age and her how much her disease is.
Ma'am, if we tell our patient that we are just screening you for cancer, so the
Mm-hmm.
word cancer screening, that is also patient take it as a trauma, and the time taken for the report to come, they are very anxious during that period. So what will be my report and how will the things be? And they just take it like that they have got the cancer, even if we do just the screening. So can Dr. Anita Malik ma'am, you can enlighten? So what kind of reports we can get in pap smear?
Okay, so once a patient is there with you with symptoms of discharge, dyspareunia, and bleeding and these things, so we explain the patients like these tests are required to diagnose the problem. So they usually agree with pap smear with the biopsy. So we have to convince them for those tests.
So should we do universal screening?
Yeah, so this pap smear is recommended is as per the guidelines. It is recommended after the age of 21 or before 65.
So Dr. Anita Kant ma'am, how frequently we should
Yes.
pap smear?
So,
Uh,
once the lady or the girl has been sexually active, 3 years from there on, we should start screening. And every 3 years, if the report is normal. Of course, if the report is abnormal, she'll need to go for further testing like colposcopy and biopsy and treatment if required. And accordingly, she'll be treated. But 3 years till the age of 65 years, because after that, the chances of CA cervix reduce remarkably.
Ma'am, what is combined screening?
Combined screening is actually liquid-based cytology, wherein not only the abnormal cells or normal cells are studied in the cervical smear, besides that, even the HPV virus is also looked for. And they look for the high-risk viruses, the low-risk viruses, and according to the presence of virus, then the interpretation of the cytology is done. If it is just a mild dysplasia plus virus is present and it's a high risk virus, naturally the grade goes up and the amount of treatment that you need to do goes up. In case HP virus is not present and she has only very mild dysplastic changes, which are like severe inflammation, then local treatment can also help.
So does it make the frequency different? Means earlier you told that 3 yearly we have to test with LBC.
That is
to HPV, any difference is it? Means can we increase the interval of screening?
no, we don't
If it is
increase.
negative?
If it is negative, we don't increase the frequency. As a matter of fact, if now the trend is this, that if once we find that HP virus is negative, we should counsel the patient to go for vaccination, right? And if vaccination is not done, then 3 year interval is good enough. But in case it is positive, so then screening goes away. Then we are going to treat whatever is positive, whether it's a precancerous lesion or it is a early cancer or a late cancer, then we go into the treatment part. Then screening is not required anymore.
So here I want to reframe ma'am's sentence. So for if we are doing the pap smear alone, the frequency should be 3 yearly, and if we combine it with HPV DNA, then frequency can be 5 years.
Yes, sir. If it is normal, so then we can do it 5 yearly. So we are screening our patients. So is there anything else, as madam was telling, HPV? So ma'am, please elaborate what is HPV? Dr. Anita Malik ma'am.
Yeah, HPV is a virus, human papilloma virus. Most of the females are infected with this virus, but not all females they develop this cancer. Because the females who are immunocompromised, the immune system is low, only those females they develop cancer over the years, in years. Because if we check in normal population, normal females, most of us are infected with HPV. But that doesn't mean all of us are going to have this cancer. The only females who have an immune system low and the virus invades, in those cases, those females, they develop cancer.
So continue, ma'am.
Yeah.
So what are the high risk factors in which we should be very vigilant and inform our patients about HPV infection?
Okay.
Those.
Yeah, ma'am, please go ahead.
No, sorry, I thought she was talking to me.
Sorry.
Yes, boli.
Ma'am, please, I think this
दोनों
question
अनीता है,
so इसीलिए थोड़ी सी मुश्किल आ रही है मैम.
Yes, I agree.
तो आप
Yes.
बता दीजिए मैम, डॉक्टर अनीता कैंप मैम, you continue.
Okay. See, those people who have had multiple partners or those who started to have sex early on in life, and those who are very poor in hygiene. Smoking is another factor which adds to the tendency to develop cervical cancer, or those who had a smear and they found that HPV high risk type was positive, but they did not get themselves vaccinated. These are the high risk women. Not using any mechanical contraceptive again adds to the high risk behavior. So these are the people. What happens is that these high risk viruses, they tend to enter the cervix in the transitional zone, and like ma'am said, the immunity of a woman will kill them. But agar repeated infections keep on happening, or her immunity is low, then these viruses will make a home in the patient's cervix, and they will start growing in the transitional zone. So as they start growing over there, they invade the cells, they invade the nuclei, they alter the DNA, and these cells then tend to proliferate. When they proliferate, naturally it turns into precancerous and then into cancerous lesion. Earlier it is localized and then it spreads.
So is it possible in monogamous relationship or even single sexual intercourse episode?
Yes, it is possible. It is not such case. It is not possible. It is possible, but definitely the chances get lessened.
So Dr. Anita Malik, ma'am, how can we prevent HPV infection from happening?
So we cannot prevent HPV infection. The only way is the barrier method, when you're using a barrier method. So this is the one thing. And the two more things we can do to prevent the cancer is the first the screening, and second thing is the vaccine. The two major things we as a preventive medicine, as a preventive for this cancer, the two things, the screening and second is the vaccine. These are the two only way to prevent cancer.
So I think we should make it other way around, vaccination and then screening, because so just elaborate about vaccination. What is the age group which is most benefited with the vaccination?
Before, it should be before marriage. We can say that before sexual exposure, but it can be given after marriage. In after marriage, it can be given. It is effective even after that also. Yes.
But nowadays the concept of adolescence immunization, means child immunization, who are entering in adolescence, means just like 9 to 15 years of age group. So should that be given at that time? So just
yes, it is
explain for the audience benefit.
Yes. These
What
vaccines,
awareness about HPV vaccination.
These vaccines are more effective when you give before HPV exposure. That means it should be given before marriage, before sexual exposure. In that case, that will be more effective. But it can be given after marriage too, once the female is exposed to infection, but the virus is not invaded. Yes.
Okay.
So between 9 to 15 years, generally recommendation is give two vaccines 6 months apart, dose 1 and dose 2. Or if the lady is married or after the age of 15 years, then you need to give them three. First dose is, day 0. Second dose is after 2 months, and third dose is after 6 months. If for whatever reason, it may be that she forgets, it may be that she's out of country, she couldn't take the vaccine, it may be that she's pregnant, so she's had to defer the vaccine, then we suggest that as soon as you remember or as soon as you're fit to take the vaccine, take that missed dose. And if the third dose is still to be taken, give a 4 months gap. And it should always be the same brand, because now we again have two brands. One is an Indian brand, Servovac, and another is a Gardasil. So always stick to the same brand, so that is the effect is maximum benefit obtained by you.
So what is meant catch-up vaccination?
Catch-up vaccination is this, that if you've forgotten, then you complete the dose. You don't have to repeat what you had taken earlier. If you have taken 1 or 2 doses, you don't have to repeat them, but you can take the remaining doses. And catch-up vaccination can be done at any time, at any age. Recommended so far is 40 to 45 years. Certain countries are also giving till 45 years. There is no need of a booster as of now. There is a company who has done studies over 24 to 26 years also. Some of the studies have been done, and they say no booster is required after the required 3 doses.
So ma'am, there is very much boom of postpartum immunization about HPV vaccination.
That is very important.
Yeah, and there are two brands. What is there is one tetravalent and one is nanovalent. Means those who cover 4 and those who cover 9. So
our Indian
which one is
vaccine,
better?
Indian vaccine is tetravalent, and Gardasil is making two. One is a tetravalent and one is a nanovalent. Nanovalent, they say, is having more high risk viruses in that, and it will cover some of those viruses which lead to problems in men also, other cancers than cervical cancer. The anal cancer, outside the anus, sometimes warts will appear, which can turn into cancer. Those are covered, but this is as per the literature given by Gardasil company. But generally, four tetravalent is more than enough, and it gives you sufficient immunity to fight with all the high risk viruses.
Dr. Anita Malik, ma'am, about continuing with the HPV vaccination. If a girl, at times we see in our OPD, girl comes with the genital warts. So what should we do? And she is scared that she may end up in vulval or cervical cancer. So what do you detail about it?
So for the warts, see, I am dealing with the cancers only. So what we are doing is we refer those cases for a skin dermatologist. So they use podophyllin and local treatments for that, and we try to boost the immunity of that patient. Okay, so that is the only way, and if the and for we recommend them for HPV vaccination.
So, ma'am, sometimes if young lady gets this CA cervix, that is means just a growth is seen on PS examination, and we find she has full fledged. So, does her partner is also at risk of getting cancer because of sexual activity, and they were
No.
not aware of it?
No, cancer is not contagious here. Only the HPV infection is contagious. So in males, if the female is infected or the male is infected, there is risk of transfer of this infection, but not the malignancy.
So at times तो some males say कि अब तो ये गई काम से, इसकी जिंदगी भी गई और quality of life भी गई. So are there any treatments which maintain if a young woman gets CA cervix? So is it so that her quality of life, sexual life, even fertility, everything goes off with the treatment? Or we can preserve fertility and sexuality both?
Yes, we can preserve fertility and sexuality both if the patient comes in early stage. There is enough data that if the patient comes in early stage, there is surgical transposition of ovaries during treatment. So, fertility preservation surgeries are there, robotic surgeries they are having. So up to a stage, the surgery is the mainstay of the treatment. But if the female comes in very late stage, if the tumor size is more than 4 centimeter, in that case, or if there is lymph node positive in the scan, the ideal treatment is radiation along with the chemotherapy. So in that case, it is not possible to preserve the fertility if the patient is receiving radiation. But yes, sexuality and these things can be preserved. The patient can lead a normal life after these treatments even.
So, can you elaborate about the radiation therapy? Means sometimes earlier when we were in MBBS students, so we were seeing they just put a mark on their pelvic region and that radiations were given out. So that was a horrible scene. So is any new advancement is there, just like brachytherapy or means? Can you elaborate, ma'am? Dr. Anita Malik, ma'am? We are just continuing with the if CA cervix has happened. So then we will come back to vaccination again and precancerous stages. Dr. Anita Malik, ma'am? We want everyone to know there are advancements in chemo as well as the radiation therapy which improve the quality of life. So, ma'am?
Yes. Am I audible?
Yes.
Yes, you are.
Yes. So we have moved to a new era. So earlier, the treatment was given with the older machines, and there were large volumes. So the side effects were much more high. Now these days we are doing image guided radiotherapy. The volumes are less, and under CT guidance we are giving treatment to the patients. So side effects are very much less. And even elderly females, 80 plus, they tolerate the treatment well. So
Okay.
with the yes, so with this surety that the treatment is going precise to the targeted area, the treatment results are much better.
Ma'am, at times we see, Dr. Anita Kant, ma'am, that
Yes.
if
Yes.
patient with chronic vaginal discharge, without investigation, they go for hysterectomy. Someone, their neighbor, someone has told them, you are getting discharged, you will develop cancer later on. So you just get rid of uterus because your family is complete. So is it so? And what is your take on it?
See, long time back, I'm talking about 2 generations back, when all these pap smear and knowledge about cervical cancer was not there, women would not go to a doctor. So any kind of white discharge was like a red herring. And the women would say, please go to a doctor, tumko cancer hoga. So that was a way of pushing them to go to a doctor and take treatment, get a checkup done. Routine screening, routine checkups were not done. So from there, that scare has started, and how much so we try to convince the women, they are not convinced. They always feel that white discharge may their bones are being dissolved and coming out, their body is getting weak. So to stop that, they need to take out their uteruses. In a particular state, I had gone for a camp about 15 years back, and not a single woman over 35 had her uterus intact. I was really shocked. I was a youngster at that time, and I could not just fathom कि इतनी फटाफट इनके यूट्रस निकल रहे हैं. But that is what happens. गांव की लेडीज को समझाना बहुत मुश्किल है. Their awareness is कि family complete, white discharge, uterus निकालो. They don't know what all side effects will have because now they are living so much longer, and so many other problems will arise in their body. So we just need to counsel, maybe put it more on media. See a single lady pretending to be dead from CA cervix awakened so many women. Every day I was getting 5 to 10 queries about मैं लगा लूं वैक्सीन, मैं अपनी बेटी को दे दूं, मुझे कैंसर तो नहीं होगा, मेरा पैप स्मीयर कर लो, एंड जो कि पहले नहीं हो पाया. तो हम ऐसे ही कोई आई थिंक सेंसेशनल मीडिया कैंपेन चलाएं तो लोगों को समझ में आएगा कि what is happening and what we should actually ideally do.
So, ma'am, what are the treatment options we can offer them with just unhealthy cervix or means just in precancerous stages?
See, precancerous stages can always be treated. We do a colposcopic guided biopsy and then determine, okay, it is precancerous, it's early cancer, depending on that and depending on her age. If she still wants to have a baby, then, and there is no local spread, the ultrasound and CT has been done and that has been established. Once we have decided that part of the cervix can be removed, we have leap therapy where only the transitional zone is taken out. We have a cone therapy where the cone is taken out with negative margins around the local growth or whatever lesion that we can see. In nowadays, so much ma'am will be able to tell much better. She deals with cancers. I have never done it. I've read about it. They take out the whole of the cervix and then take out all the pelvic lymph nodes and then attach the uterus to the vagina directly, whatever worth it is, but at least the ovaries continue to function if the uterus is not taken out for a longer time, and the eggs can be taken. She can be a mother through surrogacy or through her own uterus. That is a definitely added advantage.
So just like if report comes like SIN or ASCUS, in those cases, we can give them cryotherapy or the thermoablation. So local
Sleep,
therapy
yes,
is,
yes,
yeah, that
yes,
can be
yes,
given them to give them relief because one concern is white discharge. So that can be taken care of if it is coming from chronic cervicitis or means local therapy can be given. And
yes.
another is postcoital bleeding and sometimes the recurrent urinary infections. So I have seen some patients coming with a recurrent UTI and they are just taking from the chemist medications and they turn out to be CA cervix, maybe stage 2, 3, whatever it is. So we can create awareness among them. White discharge doesn't mean removal of uterus because of fear of CA cervix. So that's again, so that is the treatment we are giving. So coming back to the prevention of CA cervix. So because the 80 to 90% are through HPV infection, and it is a long process. It's not today you got HPV infection, tomorrow you will get CA cervix. So it takes roughly, we have the time window period of roughly 8 to 10 years. So during that time, we can treat them locally. So this is the vaccine preventable condition, and how to create awareness among people about this. Because this is among the, means we are discussing about the medical professionals, but we have audience, those who, if patient comes to them, they tell them to go for pap smear or take HPV, they don't agree. So what are the problems you encounter in counseling these patients?
See, counsel
How
till
to
they
counsel?
agree.
Yeah.
Till
So
they agree.
what strategies you acquire? So
First, like you said, postnatal patients, they come to the clinic wherever there is a child vaccination going on. They are bringing their children. So we tell them, you are coming here with your child to get the child vaccinated. In the same visit, you take vaccination for yourself also. Now that we have an Indian slightly cheaper version, naturally it will go to help in a long way. So vaccination in that captive time period of child after childbirth, that is one thing. Then adolescent vaccination very soon will be included in the vaccination program, and it will go a very long way in preventing cancer cervix. Then we should also try and vaccinate the men and the boys also, because there also is a big potential of preventing cancers in them. And if they are treated for HPV vaccine is given to them, naturally they will spread less HPV to their counterparts, their spouses. So all these are there, and of course we have media, we have magazines. Every doctor takes out 1 minute to tell every woman about her daughter being saved or daughter-in-law being saved from cancer. Maybe out of 10, one will listen.
okay. Dr. Anita Malik, ma'am, you must be getting patients of HPV related cancers, because for women it is CS cervix, but we should talk about their counterparts also, as madam has told. What male cancers in males we get with HPV infection, so that we can warn them, and how they get it.
So the penile cancers they are, but there is no routinely it is not checked like it is HPV related or not. So the penile cancer, this is the most common associated with this. HPV, other cancer, HPV also causes other cancers like oropharyngeal cancers. So one study shows there is 20 to 25% incidence of oral out of 100. These many 20 to 25 patients, they have HPV related oral cancers. So this is that much prevalent. So this can be we can make the people aware about this, and is a kind of preventive this thing.
So we
Yes.
have to tell them, so how they get oropharyngeal cancer with HPV.
So
Is it
that
with abnormal sexual practices?
Yeah,
Or
yes, this is due to abnormal sexual practices, and they get their oral cavity that infected with this virus. So yes,
So if male gets that penile warts, or
yes,
do you have any treatment for him? Means treatment means preventive. Further, he may get, as we had seen in genital warts for females. Is it so for males also? Means do males also need HPV vaccine?
yes. It is not recommended. It is not in the males, but yes, it is recommended in females. In males, the counterpart, we advise them to build the immunity to treat these genital warts with the medicines and antiviral drugs. So
So we can't give them HPV vaccine, means that is not recommended. But some
not
countries say that males also, means in their immunization schedule, they've included males also.
yes, maybe in future we'll get more data that this vaccine will help males in preventing this cancer. But so far now the females, they now we have enough data and recommendations in female patients to to use this as a preventive tool.
For both males and females. So
Yes.
yes, so that's nice.
Many countries like Australia, they want to give it to the young boys itself because it is very well known and it is also, although not every country and every government would like to accept, but it has been seen that in jails, HPV infection is much more common amongst the men also. So there also routine vaccination would be a good idea. Proponents are there, and let's see how it gets picked up, like India has picked up for adolescents. Sooner or later other people will also come in the under the umbrella of vaccination.
So as we are talking about female health, prevention means strategies to prevent CA cervix, but shouldn't forget that females have another important part in their body, and which the cancer of that part is number one.
Yes.
So we shouldn't forget the breast. So can we just touch up the breast also? That is for our audience information, as well as the involving it into the practice. Then what do you suggest? How to create awareness about screening for breast cancer also means because for cervix we have made our population aware by mass media and our own counselings. So what about breast cancer? Self breast examination. So we should
Yes.
make our people aware of it. So just
We
word about it so that adolescents, adults, as well as the elderly women, because that is the number one leading cause of cancer in women population. And
lot of awareness is there in the urban population. Breast self-examination, we tried, at least I try to teach to each and every female who comes to me. And I have posters all over inside my OPD examination room where they can stand for a minute while they are changing or robing or disrobing so that they can easily see how to go about it. We teach them how to do it and when to do it, and once a year they have to come to a doctor to get it done. Those now there are guidelines that after 35 years, if there is a risk of developing cancer, there's a family history, then you can start getting your mammograms earlier also. Now previously it was only after 40 years of age, and definitely everybody is scared now. Most of the people, at least in the urban population, they find a small even a boil on their breast, they come running, cancer to nahi ho gaya.
yes, that is it. So Dr. Anita Malik, ma'am. So how will you encourage girls to go for means the girls and ladies in your practice? You must be seeing many of the CA breast patients. So
Yes, yes. So earlier it was like this cancer was of the elderly females. So mammography is recommended for the elderly females. Now we are seeing patients, young patients having these disease. So majority of them, they have some family history. 20-25% there is family history. Rest these they have the sporadic origin, maybe some due to gene changes, some maybe due to lifestyle changes. These may be the reasons. So in those patients, the patient, young female, if comes with a lump, we advise to do ultrasound. For a young patient, it is ultrasound, and for elderly, it is mammography, that is X-ray mammography. So there is a grading system for that. If it is suspicious of pregnancy, in that case, we advise further testing like needle test, FNAC, or biopsy in those cases. So this is how we proceed.
what is your take-home message for our audience, Dr. Anita Malik, ma'am?
Yeah. The take-home message is, so early to detect, and there is good chance of cure. We are detecting it late, so 80% of the patient, they are coming in late stage, so the cure rate is 20%. if we get this 80% in early stage, the cure rate will be 80%. So 80-20 ratio runs. So if we get it early, the treatment modalities will be less. Maybe only surgery will required if we get it early. Right. So बहुत सारे modalities नहीं चाहिए. Surgery, radiation, chemotherapy is not required if we detect it early. So if it is cervix, even if it is C breast, so the mortality and morbidity can reduce if we detect early. Yeah.
Ma'am, Dr. Anita Kant, ma'am, your take on this.
I'd like to say it takes few years, like you said, from the start to the proper development of cancer. So nowadays we find, because all the labs are giving very frequent, it's 500 tests and 500 rupees and so on and so forth. We keep getting, people get it done every year, every 3 months, every 6 months, कि देख cholesterol तो नहीं बढ़ा, ये तो नहीं हुआ, वो तो नहीं हुआ. So this is one of those things. You just have to go to a doctor and get a pap smear done. If anything is picked out, you will be cured without any cancer happening. So why not go for it? If you are okay, your whole family will be okay. So to keep the whole family happy and healthy, first the woman has to be healthy. So please get up, go tomorrow only to your doctor or maybe today evening and get a pap smear done is the message to everybody.
We can tell them because of the medical care, we have added years to our life. But we want to add life to our years, but we have gained. So to add that, we should get our, we spend so much on our birthday parties or anniversaries, special events in our life. If we club our health checkup with it, especially our genital health as well as the breast examination, our risk areas, so that will be very good. So we just that is easy way to remember. Every birthday we should get our health checkup done. That we are just getting the grace in our life.
Right.
Okay.
Thank you so much for a happy ending.
Yeah. So now I expect from each one of the audience that they will counsel at least one mother in their OPDs. If they can do it more, but at least they should target one mother to counsel her about HPV vaccination for her and for her daughter, and just tell them the healthy points in their life. And if needed, they should go for their that HPV testing, pap smear. So that should be done. If we make it a target that for gynecologists we have to do minimum one pap smear a day and counsel one mother a day, we will do a great job. So I'm thankful to my panelists. They have done very good job and made the things very simple for our audience to understand and for me too. Thank you.
Thank you.
Thank you.
Okay. Thank you, ma'am.
Happy Women's Day.
Happy Women's Day to all of
Thank
us.
you.
Yeah.
Thank you.
So we are Durga, we have to do multitasking. So this should be in our one of our arms. That we
Yes.
have to take care of our health first, so that we can take care of health of our family and our society. Okay. Thank you, ma'am.
No.
Thank you.
Thank you so much, ma'am. With all your permission, I am closing this session for today and hope to see you again with different